Imagine waking up one fine morning and feeling your eyes burning, unappeasably forcing you to rub them, suddenly turning the white part of your eyes pink or red. Conjunctivitis, a sinister culprit of the realms of ocular infections, spares no one and spreads like wildfire. Conjunctivitis, commonly known as pink eye, is an utterly uncomfortable and severely contagious ocular infection. Both bacteria and viruses can infect the eyes, but viruses are behind the majority of the infections. However, allergens and irritants can also initiate inflammation, causing teary and irritated eyes. Currently, a huge rise in pink eye cases among people of all age groups has been reported in Vietnam, India, and Pakistan. A sudden massive outbreak has started affecting the people of Karachi, Lahore, and other major economic hubs of Pakistan. In Pakistan, 86,133 cases have been reported only in the Punjab province until September 28, 2023, while the outbreak still spreads to other provinces. Let's move on to unravel the mysteries of this antagonist and arm ourselves with the knowledge to encounter this ailment and its intense grip on our vision. What is conjunctiva? Human eyes are covered with a thin, clear tissue called conjunctiva. It acts as a barrier and protects the eyeball and inside of the eyelid by keeping them moist through mucus secretion. Conjunctiva coordinates with lacrimal glands and meibomian glands that lubricate the eyes through the formation of tears. Lacrimal glands produce an aqueous portion of tears, which in turn mix with mucus secreted from conjunctiva and oil from meibomian glands and eventually form tears that wash off the eyes and protect them from infections. What is conjunctivitis? Sometimes, due to direct exposure to the environment, the conjunctiva can be easily penetrated with viruses, bacteria, or any other irritants that lead to swelling and irritation of blood vessels in the eyes, giving red or pink color to the whites of one or both eyes. This inflammation of the conjunctiva is referred to as conjunctivitis. What causes conjunctivitis? Most of the infections are caused by viruses. However, bacteria can also be the reason behind it. Sometimes, allergic conjunctivitis can also occur. Allergens like pollens and animal dander cause allergic conjunctivitis. Unlike viral or bacterial conjunctivitis, allergic conjunctivitis is not contagious. Let's move on and discuss its causes one by one. Viral conjunctivitis. Viruses cause the majority of the cases of conjunctivitis. Adenoviral keratoconjunctivitis or epidemic conjunctivitis is a term for conjunctivitis caused by adenoviruses. Adenoviruses are a group of viruses that mainly cause the common cold, but are also reported to be the primary pathogens behind inflamed conjunctiva. Approximately 65 to 90% of cases came under the name of adenoviruses. Another severe infection, herpetic conjunctivitis, is caused by herpes simplex viruses. Similarly, there are other viruses named enterovirus 70 and Coxsackie virus that are responsible for causing acute hemorrhagic conjunctivitis. These viruses were first isolated and identified in 1969 in Ghana and have been reported to cause numerous worldwide epidemics since then. Bacterial conjunctivitis. Staphylococcus aureus, Streptococcus pneumoniae, and Haemophilus influenza are known to cause acute bacterial conjunctivitis. However, Moraxella lacunata, chlamydia or gram-negative enteric flora are responsible for causing chronic cases of conjunctivitis. Chlamydia is the least common cause of chronic bacterial conjunctivitis. Few bacteria like Neisseria gonorrhoeae, beta-hemolytic streptococci, and Corynebacterium diphtheriae cause hyperacute conjunctivitis, which is marked by pseudomembranes covering the conjunctiva. The grouping of white blood cells gives rise to the formation of loosely attached pseudomembrane. Allergic conjunctivitis. Various allergens or irritants like pollens, smoke, perfume, cosmetics, dust mites, shampoo or pool chlorine induce this infection. Apart from viral conjunctivitis being the primary cause of ocular infection, allergic conjunctivitis impacts 15 to 40% of the population. Chemical causes of conjunctivitis. Any chemical penetrating the eye can lead to severe inflammation of the conjunctiva. Any acidic or alkali burn can induce conjunctivitis. However, alkali burns are more dangerous than acidic burns. Several other reasons cause pink eye, like blocked tear ducts, dry eye syndrome, autoimmune diseases like reactive arthritis, and others. Transmission of conjunctivitis. As viruses and bacteria are living organisms, conjunctivitis or pink eye disease caused by them is highly contagious, meaning that the infection easily spreads from one to another due to the transmission of these microorganisms to healthy persons. Notably, person-to-person transmission has been identified in case of viral or bacterial conjunctivitis. Their common ways include direct contact through touching one's infected eyes or sharing objects infected persons use. Contrarily, no conjunctivitis has been reported caused by allergens being transmitted from one person to another. This may be attributed to the non-infectious nature of allergens because they directly involve our internal body's immune system. For instance, some people naturally resist certain environmental particles like pollen. Whenever they come in contact with such particles, an unnecessary and exacerbated immune response is generated in their bodies against these particles. In this case, conjunctivitis primarily occurs due to internal body disturbances rather than some type of infectious agent like microorganisms. Therefore, conjunctivitis caused by allergens cannot spread from one person to another. As mentioned earlier, an increasing number of cases of viral conjunctivitis have been diagnosed in Pakistan. Such a massive number of cases is because viral conjunctivitis is like a wildfire, and the infected individuals are the primary reservoir and transmission source of infection until the disease symptoms are present, which may last for a week or two. Signs and symptoms: redness of white of eyes and inner eyelids, excessive tearing, itchy and irritated eyes. Photosensitivity is another primary symptom of conjunctivitis. Swollen and gritty eyes. Grayish or yellow discharge from eyes caused by the production of pus is associated explicitly with bacterial conjunctivitis. Diagnosis: ophthalmologists can quickly identify the real cause of conjunctivitis by observing the patient's symptoms and asking general questions like previous allergic, viral, or bacterial infection history. They may ask for acuity or eye vision checking tests if they suspect low vision or loss of vision. Sometimes, your healthcare provider may ask for a swab test if the disease symptoms are difficult to diagnose. In this test, a thin swab is moved around your eyes to soak it with eye secretions. It is then sent to the lab for culturing to diagnose bacterial causes of conjunctivitis. This test benefits antibiotic selection, especially if previously prescribed antibiotics are ineffective in treating this disease. Similarly, viral culturing may also be suggested to diagnose the viral cause of conjunctivitis, whereas diagnosing allergic causes of conjunctivitis is not possible through culturing. For this purpose, a specialized patch test is recommended, which involves the identification of specific substances causing allergic inflammation. Only rarely, fungal or chlamydial infections may also be responsible for conjunctivitis. In this case, doctors ask patients to undergo conjunctival scrap extraction for cytological analysis of ocular infection. Treatment: like diagnosis, treatment of conjunctivitis also depends on whether allergens or pathogens like bacteria and viruses cause it. Bacterial conjunctivitis is usually treated by prescribing antibiotics through tablets, eye ointments, or drops. Some parents feel it tricky to put ointments or eye drops if their children are infected. In this case, it is enough if the drop or ointment sticks with the eyelashes, as it can easily melt into the eyes from there. Fluoroquinolones, sodium sulfacetamide, or trimethoprim/polymyxin antibiotics are commonly prescribed for up to 7 to 10 days to treat bacterial conjunctivitis. However, not all patients are treated by initial antibiotic therapy. Therefore, they must require a bacteria-specific culturing test to diagnose the specific bacterial cause of their conjunctivitis or to identify whether the infecting bacteria are antibiotic-resistant. Viral conjunctivitis typically recovers on its own and does not require any medication. However, antihistamines like diphenhydramine are recommended to relieve symptoms. Cool water and artificial tear therapies are suggested in mild cases of allergic conjunctivitis. Cool water is poured on the face in an inclined position to mitigate itchy and burning sensations. Non-steroidal anti-inflammatory drugs and antihistamines are prescribed in severe cases. Prevention: avoid touching or rubbing infected eyes. Ensure hand hygiene by proper hand washing with soap and water. Avoid sharing personal items like contact lenses, makeup, cups, or towels. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.